Let me ask you about medical science liaisons, because that's where we met. What type of background do companies look for hiring medical science liaisons, and what type of training do they get from industry?
Medical science liaisons or MSLs really span the gamut of expertise. And it's really dependent on the product that the company is looking to launch on the specific expertise that they're looking for in their MSLs. For example, when we were working together, that company was a comprehensive genomic profiling company. I happen to have deep molecular biology experience, which is the science that supports that particular testing modality. So they were looking for people like me to help communicate the value of this diagnostic test to clinicians. So that's one skill set. The first skill set will always be your scientific background, whether that's oncology, whether that's genomics, whether that's cardiology, whether that's renal. That all will help to identify your best place to land. That's one. Two, and this one is not necessarily going to be found on any job description, but it is the ability to connect with people. MSLs, and the best MSLs, in my opinion, not only understand the science and can deeply talk about any publications that support the science, but they can communicate the science in a way that is digestible in a quick and manageable way for a clinician who has 7 minutes to talk to you, right? So no one needs a dissertation. What they need is the crib notes first. Later, you may need to get into that dissertation status and have that conversation. But the first part is to be scientifically credible, but then also able to have that relationship and communication management.
The importance of and the deployment of medical science liaisons has certainly grown in this era of next generation sequencing, because we're learning more about our our biological systems, the genetic pathways, both from an inherited standpoint and those that spontaneously happen over the course of a lifetime. What role do MSLs play in building and maintaining relationships with key opinion leaders and customers? Like, because we talked about that slippery slope, but we really do need MSLs in a number of different capacities.
I mean, historically, if you look at the relationship between commercial teams and medical affairs organizations in the majority of the biotech industry, there's a huge wall between the two. Commercial teams are out to go out and build relationships and complete the sales process, while medical affairs and our MSLs are really out to be what we called fair and balanced. So we're not product specific necessarily, but we understand the full landscape of the science and the clinical data around the product. And so the conversations that we're asked to have with those clinicians are not going to just point towards the product that the company is selling, but it's going to give them that full overview of all of the data that exists, allowing the clinician to make the best decision for their patients. That relationship has now evolved to where commercial and medical are really working closely together, understanding the guardrails that are necessary due to ethical and guideline requirements, but also from a strategic perspective, understanding that helping clinicians know more is going to eventually be valuable for the commercial enterprise as a whole.